This is the first time that Dr. Reddy is seeing Sonia as a patient. Standard of care require an examination of the extremities.
Oh, absolutely. This is the first time Dr. Reddy is seeing this patient who has a history of diabetes, now has kidney failure. So there are several important clues that, or several important things that we would expect Dr. Reddy, a nephrologist, or any internist to look for on examining somebody like this, including checking, physically feeling the feet, feeling how much edema or swelling there is, seeing if the pulses are present or reduced, and checking sensation. And in fact, Dr. Reddy admitted that he only did a visual exam of the legs and actually never touched the legs at that time, and certainly did not check pulses, did not do any type of neurological examination.
Do you have an opinion as to whether Dr. Reddy's examination of the extremities of Sonia on the 29th violated the standard of care?
Well, yes, it did violate it for the reasons I just reviewed.
And if you'll pull up page 473. This is a handwritten note by Dr. Reddy, timed at 9:55 a.m., so it's in relation to the same visit. And we see down there that, you see that sign says greater than 35 minutes. You see that?
That's correct.
So Dr. Reddy spent more than 35 minutes in the assessment, evaluation of the patient and her data, and within that 35 minutes, at no time, physically examined the extremities.
Well, in fact, in his deposition, Dr. Reddy admitted that he had spent less than 5 minutes, or 5 minutes or less, actually examining Ms. Dubose. So that 35 minutes presumably includes the time reviewing records, perhaps, or reviewing any films that may have been done, or lab work.
Now, let me ask you to assume that Nurse Perry will testify that at the 9:30 visit, when Dr. Reddy was present in person, that she personally informed Dr. Reddy that Sonia had cold legs, unable to move her legs, and no sensation in her legs. Assuming Nurse Perry's testimony is believed, what did the standard of care require of Dr. Reddy at that point in time?
Well, certainly hearing that kind of alarming information, Dr. Reddy should have done a complete physical examination of the extremities, as I mentioned before, looking at pulses, looking at sensation, looking at motor strength, a complete neurological examination. Dr. Reddy should have ordered further testing, as I mentioned before, to see if it was a vascular problem that was going on, including the testing I mentioned, and certainly Dr. Reddy should have called a vascular specialist in urgently to evaluate these symptoms that are very suggestive of loss of circulation to the lower legs.
All right, I want to switch to Dr. Reddy's visit the next morning. Page 480. So we're now on March the 30th. And if you'll, Dan, if you can pull up kind of number 3 down below. I'm sorry, Dan, if you can go up to it and leave that on, but also go up to assessment plan, A/P. There you go. So here we see on morning of March 30th that it says ARF/rhabdo, question mark secondary to immobility of the legs. So we have an awareness that Dr. Reddy has an awareness of immobility of the legs, correct?
That's correct.
And so down to number 3, he refers to lower extremity weakness and no sensation. Neuroconsult and MR scan is what the record says, correct?
That's correct.
What, to an internist looking at his record, what does that reflect that he's thinking?
Well, clearly, Dr. Reddy was thinking at that time that there was some sort of neurological cause for paralysis, and that's why Ms. DuBose wasn't able to move her legs. But in fact, even the day before, Dr. Reddy wrote a note that he was at 11 a.m. on the 29th, that he had been called by the nurse regarding the patient unable to move the lower extremities. So this was clearly not the first time that Dr. Reddy was aware that she could not move her lower extremities. He knew about it a day earlier.
All right, let's talk about Dr. Salmon, page 472. All right, so Dr. Salmon seeing Sonia for the very first time, 8:40 p.m. on March 29th. And he's in the, not only internal medicine, but the additional training that you have, correct?
That's correct. Critical care specialist.
Seeing, he's been called in because of a potential for pulmonary embolism. Is that your understanding?
That's correct.
And did the standard of care require Dr. Salmon to perform an examination to include the extremities?
Well, absolutely. When somebody is transferred to an intensive care unit, first of all, the generally accepted standard is that that critical care specialist will now be the captain of the ship and primarily responsible for evaluation and management. And it goes without saying that that critical care specialist should do a very complete head-to-toe examination of a patient, especially somebody who has shown deterioration in a variety of ways, enough to require intensive care unit admission, hemodialysis, and also it goes without saying, just like any other internist, he should be examining the feet at the very least of a diabetic. He should be examining the feet and legs of somebody who's in acute renal failure, and he should be doing a neurological exam on the patient as well. So all of those should have been part of just a routine examination at the time of admission to the ICU by Dr. Salmon.